Breast is a modified sweat gland which is derived from the ectoderm. It contains 15 to 20 lobes. We'll see what are the lobes in further slides. So we'll see about the extent of breast. It extends from second rib to the sixth rib vertically, and from horizontal, let us see here. See, from the lateral border of the sternum, see mid axillary line. Yeah, this is the extent, horizontal extent. And relations, two-thirds of it rests on the pectoralis major. So I'll give a rough idea where the pectoralis major lies. So this part, all this part is pectoralis major, and serratus anterior is lying somewhere here. So two-third of it rests on the pectoralis major, and one third rests on the serratus anterior. And we have another muscle here, which we call it as external oblique aponeurosis. And coming to the layers from skin to the chest wall. So just remember this thing, this flow chart. So this is all about skin. This is skin part, and this is the breast. And after breast, we see here this space, we call it as retromammary space. And below retromammary space, there is a fascia. Fascia is happening. Just ignore this labeling. This is fascia, pectoral fascia, and this is retromammary space. And next, beneath that, we have pectoralis major muscles, pectoralis major and pectoralis minor muscles, and beneath it is chest wall. See, this outer part is skin, and here it is nipple, and this green color part is pectoralis fascia. And this space, we call it as retromammary space. This is basically free space, and it contains loose areola tissue. So this helps in mobility of the breast. And next, there are two muscles here, pectoralis major and a pectoralis minor. And here we get a chest wall. Breast, and the central part is nipple, and this nipple contains circular and longitudinal muscles. So the circular muscles make nipple stiffen, that is erection, and longitudinal muscles make it relax and they allow retraction. Now one more point here is areola. What is areola? The surrounding dark area around the nipple is called areola. This is areola. So what is its function? So we call it as a circular pigmented area which is surrounding the nipple, and this contains modified sebaceous glands which we call it as Montgomery glands. So what is Montgomery glands function? Montgomery glands. So Montgomery glands, they enlarge during pregnancy and lactation, and the function of areola is to lubricate and protect nipple. Function of the Montgomery's glands is to lubricate and protect nipple and areola. That's it. Fence. So extension from upper outer part of the breast, and then it passes into the axilla. So let's see what it is. So this is a breast, and we have four quadrants in the breast. This is upper outer quadrant, this is lower outer quadrant, and this is upper medial or inner quadrant, and this is lower inner quadrant. So from upper outer quadrant, there is an extension into the axilla. This is called axillary tail of Spence. Axillary tail of Spence. So, and here lies the foramen of Langer. Next, so what is its clinical importance? So, as it lies in the axilla, it may be mistaken for lipoma. So, and it also has relation with axillary lymph nodes, mainly anterior axillary lymph nodes. We call them as suspensory ligaments of Cooper. So these ligaments, they connect skin to the pectoral fascia. So its function is maintaining the shape, and it also supports the breast now. So their clinical importance here is cancer cells invade these ligaments. So when they invade the ligaments, these ligaments are gonna contract. So now the shape is lost, right? So the skin is pulled inward. So that time we see dimpling of the skin. And if cancer is extending deeply, so the breast is becoming fixed to the pectoralis major. So when it is becoming fixed, automatically its mobility decreases. And remember one point here, breast is a dynamic organ and it changes during puberty, pregnancy, lactation, and involution. Coming to the breast parenchyma, we have grape-like vesicles which we call it as acinus. And when these acinus, group of these acinus, we call it as lobule. Two or three or more than two or three acinus, we call that as lobules. And now coming to group of lobules, we call that as lobe. Suppose a lobule. So there is a small duct here, which we call it as ductule. So this lobule plus ductule we call it as terminal ductal lobular unit. Lobule plus ductule, and this ductule is drained into the collecting duct. Collecting duct, and this collecting duct again is drained into lactiferous duct. This is compared to collecting, it's little bigger duct, lactiferous duct. And there, for suppose this is a nipple, and before entering the nipple, this lactiferous duct is little dilated. We call it as lactiferous sinus, and this is reaching the nipple. We see here their axillary artery runs like this, and its branches supply to the breast. So this branch is lateral thoracic artery. Lateral thoracic artery. And here we get another branch. We call this as thoracoacromion artery. Thoracoacromion artery. And from here we get two more branches. First one is internal thoracic artery. And again we get another branch. We call this as medial mammary branches. Along with this, we also have intercostal arteries which supply the breast. And coming to the veins, the same things, axillary artery supplies it. And lateral parts are drained into axillary veins, and medial parts into the internal mammary veins, and lower lateral parts into the posterior intercostal veins. Coming to the nerve supply, it's simple, second to sixth intercostal nerves. So lymphatic drainage, we have four quadrants in the breast. So the upper lateral drains into anterior axillary lymph nodes, and the lower lateral into the posterior intercostal lymph nodes. Coming to upper medial, it drains into internal mammary lymph nodes of the same side and as well as the opposite side also. And the lower medial into subperitoneal lymph nodes. Here, this is connected to the ovary. So there is a clinical importance here.